Thank you all for watching On Call for All Kids. Today we're talking about bumps and bruises in kids. We'll be going over the most common causes of bumps and bruises, how caregivers can treat them, and when we should worry about these bumps and bruises. I'm joined by Dr. Ebony Hunter. She's an emergency medicine physician at Johns Hopkins All Children's Hospital. So great to see you, Dr. Hunter.
It's good to see you too, Ashley.
Well, it's inevitable. Kids will get those bumps and bruises from time to time. What are some of these causes, though? What causes them to happen?
So many different things. I think the common things that we see in the ER, the two most common, are insect bites and then bruises from trauma. So if I had to name the top two, those would definitely be the top two.
Okay, so regarding insect bites, what do parents need to do if they see one of these on their body, or even multiple bites?
I think the most important thing is to cleanse the area so that it doesn't get dirty. And so they can just use soap and water to help clean the insect bite. Try to prevent the child from scratching the area. They may have to cut their nails to do that. And if there's moderate to severe itching, maybe try some over the counter hydrocortisone. If they do the hydrocortisone, I would avoid any placement around the eyes, the mouth, or the genitalia, but it's very appropriate to use.
Can these actually get infected, though? Should we worry about that?
Absolutely. If they notice any redness, swelling, pain, warmth to the area, then that is signs that they are starting to get infected. And we do see this when kids scratch a lot. So if they see those signs, I would recommend that they seek an opinion from a healthcare provider.
Well, how can we prevent bites from even happening?
I think the most important thing is the use of repellent. There's multiple types of repellents that are sold over the counter. There's a DEET based one, but if families don't want to use DEET frequently for their children, there are also essential oil based ones that work pretty well too. Both of them work perfect.
Well, let's move on to bruising. This is something common we can see in kids. What typically causes it?
The number one cause of bruising is usually some sort of trauma, whether it's a bump into some furniture or from heavy play or while they're on the playground. But usually it's trauma.
When should parents actually become worried about this bruising that's happening?
I would say become worried if there's any signs of deformity under the bruising. So that may mean that there is a fracture, a bone fracture under the bruise. And if there's a laceration where the skin is apart and needs to be brought together, that may indicate that the child needs stitches. So both of those are definitely some reasons to seek a healthcare provider's opinion.
But if they're looking pretty mild, is there anything that we can do as parents to help treat these?
Yes. So rest the area. Obviously, if it's on like the hand or the foot, try to get the child to rest and ice and compress the area, elevate the area. That being said, sometimes it's hard to get children to allow you to place ice. So just doing what they will allow you to do to help them. If they're having some pretty moderate discomfort, you can use over the counter ibuprofen or acetaminophen to help with pain. I would not recommend aspirin, as we do not recommend aspirin in children less than 18 years of age.
How long do these bruises typically last? Should we expect to be seeing them?
Most bruises will stick around for 7 to 14 days, 1 to 2 weeks. In the first couple of days, they may change in characteristic quite a bit. May get a little bigger, then a little smaller, maybe any different color of purple, blue, red, and that depends on the pigmentation of the child. So that's what you would expect, like over the course of the bruise.
And lastly, Dr. Hunter, are there any other types of bruising that we should actually worry about as parents?
If you notice that the bruise, your child is bruising more frequently and normally didn't, so like normal child play, and you're noticing bruise after bruise after bruise, and they didn't normally do that, then yes, I would say absolutely seek care for that, as that may be an indication of some underlying illness that we need to investigate.
All right, Dr. Hunter. Well, thank you so much for joining us and all this great information about those bumps and bruises.
Of course. Thanks for having me. It's always a pleasure.
And we thank you all for watching us as well. If you have any topics you would like us to look into, you can comment below right here on this video. And you can also check out our website at hopkinsallchildrens.org/newsroom, and you'll find many other pediatric healthcare resources there as well. We'll see you next week.